Hello, the following presentation will be about physical assessment techniques. So there are several skills which the nurse must develop to complete a physical assessment for each patient. These skills include inspection, palpation, percussion, and auscultation. These basic skills will be reviewed briefly here as we discuss physical exam using the concept. More detail will be added. For instance, the order that we do these skills changes from system to system. Inspection is defined as viewing the patient visually. Palpation is a technique of pressing the patient's tissues to evaluate for texture, temperature, dampness, organ location, and size. Percussion is tapping on the body part and listening for the sound that is emitted. And then auscultation is listening with a stethoscope to various parts of the body. So what are you looking for when you're looking for things? You want to look for symmetry of their symmetry. You want to look for discoloration, any types of breaks in the skin, swelling or edema, and then the appearance of the skin. Is it dry and flaky? Is it shiny? Is it distended? So distended would mean elevated, or it looks like it's edematous, or it looks like it's swollen. That'd be another way to describe distension. Palpation. So palpation uses a sense of touch as a part of the assessment. What we're looking for is we're assessing for swelling, any type of vibration or pulsation, rigidity or spasticity, crepitation. Crepitation is like air popping underneath the skin, lumps, masses, presence of pain, or tenderness. So one of the things I'll say about palpation is you'll see on the top, on the example A, which would be the top example, if you notice she's lightly pressing on the patient's stomach, just using the first I guess 1/3 of her fingers, or his fingers. That's considered light palpation. That's what we're looking for with light palpation. We're looking for swelling, vibration, rigidity, crepitation, masses, lumps, or if our patient tells us that hurts, or that's painful, or they guard that area if it's tender. B, the picture B is actually looking at deep palpation, where the nurse depresses the tissue to assess the condition of the underlying organ. What I would say is that deep palpation is used for diagnosis. And as a nurse generalist, we don't diagnose anything. So nurse generalists do not use deep palpation. We are not assessing the size of an organ. That is considered a maybe a nurse practitioner or a physician duty, and not the duty of a nurse generalist. So for our uses, we are going to be using light palpation. And when you're in the clinical area and when you're in the simulation lab, you'll actually get to practice this technique. You're just using the first third of your fingers. You're not pressing deeply. So, what can your hands sense? If you think about what part of your hands will feel certain things. So your fingertips actually are the best for fine tactile discrimination, such as skin texture, like a dryness of the skin or flakiness of the skin, swelling, pulsations, or lumps. The grasping action between the thumb and the fingers helps detect position or shape of masses. The dorsa, which is the back of the hands and the finger. We use the back of the hands or finger to help, the back of the hands and fingers to help us identify temperature. The skin is actually thinner here, so you can feel variations in temperature. So again, you can't wear gloves and feel temperature, so gloves would have to come off and you'd use the back of your hand to feel for temperature. And then the base of your fingers are best for vibration. Percussion. So percussion elicits a characteristic sound or vibration. It helps determining location, size, and any type of density of an organ or potentially a mass. Percussion can also assist with determining location, size, and density. Here are some of the sounds that you may hear. One is a normal sound is something called resonance, which is a medium low pitch sound. It's hollow, and that's what you hear over normal lung tissue is resonant. Then we have hyperresonant. Hyperresonant is heard over an adult lung when there's too much air in the lung or too much air around the lung. So hyperresonant is an abnormal assessment, and resonant is a normal assessment. Resonance is often very hard for a nurse generalist or a novice nurse and a fairly new nurse to hear, because you have to be able to percuss between ribs and between cartilage and between bone. So to really get in that space to hear the resonant sound is often difficult. So don't be discouraged if that's a skill that you can't quite get. I know lots of nurses that still struggle with that skill, because it is such a fine area where you'll hear the resonance. Hyperresonance is actually fairly easy to hear if you do have a patient that has additional air around their lungs. It's a loud booming sound, and it's fairly easy to hear. Plus the air that's around the lung is abnormal, and it's taking up a large amount of space. Then we have a flat sound, which is a soft, high-pitched sound, and we hear that over muscle or tumor, which we actually don't hear very often. If you try and percuss your thigh, that's what you will hear, because you're percussing right on that muscle. And then we have a dull sound, which is a soft, high-pitched, muffled sound, and we hear that over masses and organs. If a patient has a large abdominal mass and we percuss right on top of that mass, we will hear that dull sound. Additionally, if a patient has an enlarged liver and we percuss over that liver area, we will hear that dull sound. And then one of the most common sounds that we hear is timpani. So timpani is a loud, high-pitched sound. It sounds like a drum, and it's over air-filled areas. So we hear that most often in someone's abdomen. Timpani and hyperresonance sound different. The timpani is a more common sound that you'll hear. Out of these 5 sounds, probably timpani and dull are the most common sounds that you'll hear. Timpani we hear often over a patient who has an abdomen that's full of air. So then our last skill is auscultation, and it's listening to the body sounds using a stethoscope. So if you look at the picture on the right-hand side, you'll see that the bell is the smaller part, and you have to press lightly when you're using the bell. We use the bell for soft, low-pitched sounds like heart sounds if we're listening for extra heart sounds. Very rarely does a nurse generalist use the bell. We most often use the diaphragm, which is the large part at the bottom. It's used for high-pitched sounds like lung and bowel. You have to press firmly in order to hear anything. Oh, I apologize. That's a double one. So it's just some tips for auscultation. Tips for success with auscultation. You want to avoid any extra noise in the room. You may have to turn off a TV or tell a patient, I want to listen to your lungs now. And eliminate whatever extra noise you can find. Keep the patient warm to avoid any shivering, because when they're moving, your stethoscope is moving and is producing background noise. And like if you've ever listened to a radio show or you've been on a conference call and there's all that static in the background because there's extra noise from someone else's phone, that's what it sounds like. That's what it reminds me of. That's how you'll hear it, is that it's extra noise. It doesn't make any sense. It's not part of the assessment. And it's just kind of irritating. It's just kind of annoying. Another tip for success is to warm the end piece of your stethoscope. Maybe hold it in your hand for a second after you've washed your hands, of course. You want your patient to be comfortable and not uncomfortable with a cold stethoscope on them. Be aware of very hairy surfaces. They can mimic crackles. Crackles are a type of lung sound that's called an adventitious lung sound. It identifies that there's liquid or fluid buildup within the patient's lungs, and it's actually an abnormal assessment, and it's a cause for concern. So when you're listening to especially very hairy men over their back, be very aware of moving your hand while you're listening, and you have to plant that stethoscope firmly so that the hair, kind of pin the hair down so it doesn't move underneath. You can also wet the hair to minimize the extra sounds. Always auscultate on skin and not through clothing. Adding that layer of clothes can add extraneous sound. And avoid adding your own artifact, like bumping or rubbing the tubing of your stethoscope while listening. One of the common mistakes we see in new nurses, especially when they're testing for vital signs, is that something is touching or bumping the actual stethoscope, which produces adventitious sounds, and they hear something that's not there. So make sure that your stethoscope is clear, it's not touching anything or rubbing up against anything as well.